Welcome to our video on cancer of the fallopian tubes. Let's get started. Here's our overview slide. This is the sequence in which we'll be discussing cancer of the fallopian tubes, so let's begin with the definition. Cancer of the fallopian tubes is characterized by neoplastic proliferation of cells within the fallopian tubes of the uterus and is extremely rare. The key point to remember from pathophysiology is that adenocarcinomas are the most common type of fallopian tube cancers. All right, let's try a question. A 57-year-old woman comes to the physician due to left lower abdominal pain. The physical exam shows ascites. Pelvic ultrasound reveals a complex mass in the left fallopian tube. The patient is diagnosed with fallopian tube cancer. What is the most common histological type of this patient's malignancy? All right, this woman with left lower abdominal pain and ascites has a complex mass in the left fallopian tube. She's eventually diagnosed with fallopian tube cancer. As we just discussed, the most common histological type of fallopian tube cancer is adenocarcinoma. This type of cancer arises most commonly in Caucasian women. Additional risk factors include nulliparity, infertility, and genetic syndromes, for example, BRCA1 or BRCA2 mutations. In terms of clinical features, most women with cancer of the fallopian tubes will remain asymptomatic for a long period of time. That being said, it's important to remember the two clinical features that are considered pathognomonic. First is the Latsko triad, which is characterized by a pelvic mass, pelvic pain, and profuse watery discharge. The second phenomenon is known as hydrops tubae profluens. This phenomenon is characterized by colicky abdominal pain due to intermittent hydrosalpinx. Essentially what happens is that fluid builds up in the fallopian tube as a result of cancer. With time, enough of it builds up that it causes an obstruction within the fallopian tube, which leads to pain. Eventually, the fallopian tube will empty its fluid, which will relieve the abdominal pain and often lead to profuse watery discharge. Most cases of cancer of the fallopian tubes are diagnosed incidentally during surgery for other purposes. That being said, patients with this type of cancer may undergo a pelvic ultrasound, which may reveal a complex adnexal mass and/or ascites. Similar to surface epithelial tumors, cancer of the fallopian tubes will also result in elevated levels of CA-125 tumor marker. The management is with surgery, for example, hysterectomy, as well as adjuvant chemotherapy. All right, let's wrap up with a final question. A 75-year-old G0P0 Caucasian woman comes to the physician reporting intermittent colicky left abdominal pain. She has bowel movements every other day. She has noticed a left lower abdominal mass and intermittent watery vaginal discharge. Her vital signs include a temperature of 37 degrees Celsius, a blood pressure of 145 over 90 millimeters of mercury, a heart rate of 86 beats per minute, and a respiratory rate of 15 breaths per minute. The physical exam reveals ascites and a left adnexal mass. Laboratory findings are significant for elevated CA-125. Which of the following is the best next step in the diagnosis of this patient? A. Pelvic ultrasound. B. Pelvic ultrasound with biopsy. C. Abdominal x-ray. Or D. Complete blood count. All right, this nulliparous Caucasian woman has intermittent colicky left abdominal pain. She has a left adnexal mass and intermittent watery vaginal discharge. These three findings, pelvic pain, pelvic mass, and profuse watery vaginal discharge, constitute the Latsko triad, which is pathognomonic for fallopian tube cancer. Intermittent colicky abdominal pain is most likely due to hydrops tubae profluens, which is episodic hydrosalpinx due to fallopian tube cancer. Fallopian tube cancer is further suggested by elevated levels of CA-125. So the best next step in the diagnosis of this patient is pelvic ultrasound. Therefore, the correct answer is option A. Recall from this slide, a diagnosis can be made with ultrasound. Option B, pelvic ultrasound with biopsy, is incorrect because we want to avoid biopsying the reproductive tract when we're worried about malignancies in order to prevent peritoneal seeding and metastasis. Option C, abdominal x-ray, is incorrect because it's not sensitive enough to detect fallopian tube cancer. Finally, option D, complete blood count, is incorrect because this is much too general of a test and will not ultimately help with the diagnosis. So again, the correct answer is option A, pelvic ultrasound. And that concludes this section.